The Lagos State government has called on residents and stakeholders to galvanize efforts to reduce the prevalence of malaria to less than 1% in the state. Commissioner for Health, Professor Akin Abayomi, who disclosed this during an engagement forum to commemorate World Malaria Day, says this can be achieved by practicing safe environmental sanitation, sleeping under mosquito nets, and ensuring appropriate medical tests before treatment. Health correspondent Aminat Elegushi has the report.
It is World Malaria Day, an occasion instituted by the World Health Organization to highlight the need for continued investment and sustained political commitment for malaria prevention and control globally. Here in Lagos, the state government organized this awareness walk to commemorate the day. Health workers, volunteers and partners walked around the Lagos State Government Secretariat, Alausa, and its environs, distributing educational materials and engaging the public on prevention strategies. After the work comes the stakeholders and media engagement. Here, the Commissioner for Health, Professor Akin Abayomi, highlighted Lagos State's 15-year commitment to the National Malaria Strategic Plan.
Prevalence of malaria in your community is 1% or less. In other words, out of every 100 people presenting with fever, presumed and possibly could be malaria, only 1 out of 100 will actually have malaria. And if we can drive our prevalence down to 1% or less, the WHO and the Federal Ministry of Health will classify that as pre-elimination.
The African continent, and Nigeria is obviously in Africa, carries the heaviest burden, accounting for 94% of malaria cases and 95% of malaria deaths. Vulnerable populations, children, under 5, pregnant women, refugees, migrants, indigenous peoples are disproportionately affected. So the fight against malaria is on. We need to invest in malaria control, which is exactly what we're doing in Lagos State, courtesy of Mr. Babajide Sanwo-Olu.
The need for continued collective support to eliminate malaria was emphasized.
Today, we are here to show this commitment to ending malaria. And as the theme says, malaria ends with us, reinvest, reimagine, and reignite.
With the theme, Malaria Ends With Us, Reinvest, Reimagine, and Reignite, the event is a renewed call for intersectoral collaboration, improved testing culture, and sustained investment in public health infrastructure. Aminat Elegushi, LTV News.